Subscribe to our YouTube channel and press the bell icon to get the latest updates.
Hi, I'm Dr. Sanjeev P. Sahni presenting to you another episode of JIBS Infotainment. Today, we will try to understand how and if pain is passed down to generations. Recently, the topic has garnered headlines as Oscars 2022 Best Animated Feature Film Encanto showed how to break cycle of intergenerational trauma. In today's time, it has become relevant as the traumatic responses you experience today can sometimes be rooted in past experiences. But what is intergenerational trauma? According to the American Psychological Association, intergenerational trauma is a phenomena in which the descendants of a person who has experienced a terrifying event show adverse emotional and behavioral reactions. This trauma is not just experienced by one person, but extends from one generation to the next. These reactions vary by generation and may include feelings of shame, increased anxiety and guilt, a heightened sense of vulnerability and helplessness, low self-esteem, depression, nightmares, anger, fear and irritation, lack of trust, suicidality, substance abuse, dissociation, hypervigilance, intrusive thoughts, difficulty with relationships and attachment to others, difficulty in regulating aggression, extreme reactivity to stress, even silence and covert behavior. The role of parental communication about the event and the nature of family functioning appear to be particularly important in trauma transmission. Intergenerational trauma is passed on to generation physiologically, environmentally and socially. Parents diagnosed with post-traumatic stress disorder usually transmit to their children by not giving them the time when they need maximum attention during their developmental milestones. Intergenerational trauma is also known as historical traumas, multi-generational trauma, secondary traumatization, or transgenerational trauma, and usually 4 Ds are associated with families experiencing it. They are disconnection, denial, detachment, distance. Any family can be affected by intergenerational trauma. Traumatic events that may lead to intergenerational trauma are domestic violence, parental incarceration, divorce, alcohol use disorder, child abuse, for example, sexual, physical or emotional, natural disasters, death and accidents, poverty, historical events that may have an enduring effects on generations to come, such as Holocaust, refugee camps, racism, slavery, conflicts and wars. Children experience and understand the world primarily through direct caregivers and therefore are affected by their parents' modeling. Children both mimic their parents' behavior and learn to navigate future relationships based on how they learn to relate to their parents. There are certain methods through which we can cope intergenerational trauma like strengthening cultural connectedness and identity, improving the social and emotional well-being of our young people, consulting a counselor for family therapy and individual counseling, developing spiritual connections, working on cultural support and community resources, supporting good learning environments and better self-coping mechanism, improving education, family relationships and physical health, providing education and awareness about trauma, trauma responses and intergenerational trauma to teachers and parents in schools. The main way to help break the stigma related to intergenerational trauma is through knowledge and awareness that focus on strategies to support families during these challenging situations. Also, acknowledging how intergenerational trauma impacts those who have not personally experienced a traumatic event. This understanding is the first step in treating intergenerational trauma in individuals as well as preventing future intergenerational trauma. That's it for today. Thanks for tuning in. Thank you.